It is astonishing the amount of data like sitting underneath hospitals and healthcare providers that just sits latent.
Welcome to Series 2 of the Future Health Podcast, a podcast on the way we work, the work we do, and how technology will influence the future of work in New South Wales Health and the healthcare industry. We have an incredible lineup of guests this series, and we're looking forward to sharing it with you soon. Feel free to like, share, and subscribe so you don't miss a thing. Our guest today is Dr. Nik Dawson, Senior Research Associate at Faethm AI. Nik completed his PhD in Computational Economics from the University of Technology, Sydney, with research focusing on the changing labour market dynamics in Australia. Nik's work focuses on the impact of adoption of novel technologies on the Australian labour market. I'm really looking forward to learning from him how we can do this better into the future. Hi, our next guest is Dr. Nik Dawson, and we're here today to talk about the future of work, the workplace and the worker. Nik is an expert in workplace dynamics and the changes AI and is bringing to the workforce in Australia. Nik, would you like to introduce yourself and tell us what you're working on?
Yeah, sure. So my name is Nik Dawson. I am a Senior Research Associate at Faethm AI in Sydney, in a company that does workforce analytics and helps companies sort of transition workers between jobs, identify skill gaps, emerging technologies. My background is in computational economics, specifically looking at labour markets. So my main focus areas have been on how do you move workers between jobs, so labour mobility. Skill shortages is another big focus of mine, and areas like emerging technology adoption, so specifically with artificial intelligence. Most of my research has been on the side of labour demand, and so I've specifically looked at job ads data. I spent a lot of time there looking at what employers are demanding, where they're demanding it, and what frequency, the types of skills, and then from that historic work, then start to project into the future. Like, what are some of the future skill requirements? How can we efficiently move workers given different scenarios that are occurring? So that's it.
Oh, wow. That means we will have a lot of things to talk about into the future. Starting with the first thing you talked about computational economics. That's one of the things which sounds like Latin to a doctor like me. I mean, what is that about? And you're talking about computational economics and the labor market. Honestly, it sounds very alien to me. So just enlighten us a bit more about that.
Sure. It's really the intersection of kind of two disciplines, the intersection of kind of traditional economics, but with like data science techniques. So economics as a profession is changing quite quickly, merging with other disciplines, and it's largely a product of just the massive amount of data that's becoming available now, coupled with just heavy advances in AI methods, particularly with machine learning, but also other stuff with like causal inference. So you're sort of seeing the confluence of two disciplines colliding, and then I sit right at the intersection there.
Oh, that's interesting, and that's probably where you want to be when new markets open up, isn't it? So from what you highlighted, and I'm just trying to translate that, what it means in health, because we are seeing that kind of clash happening between, and the boundaries being broken between traditional health data and social data, and then social factors data and everything else. And we know that all these factors have impact in health outcomes, but we traditionally haven't looked at it. So that's just it. That whole space of digital health science and AI and machine learning tools and the capability to be able to process large streams of data from so many different streams, and then actually But then what you highlight around causal inference models as well, it's just interesting that just because something happens doesn't mean it's a cause of it. And it's just like, and that's the simplest way of putting it. But what I want to draw out a bit more is that it seems like you were in a job where you're always looking into the future. And also how do you shift between markets? And that's been one of the topics we've been talking about recently, is about, especially during this pandemic, how over specialization might actually be a thing that works against you, and being able to adapt quickly to the changes of the market. How do you see that playing out into the future?
Yeah, this is such a fascinating topic for me, because so traditional economics theory will say specialization kind of leads to wealth. It's kind of the core tenet of like Adam Smith, and for macro environments, I think that's been shown to be very true. But for individuals, I'm not so sure. So definitely there are huge gains to be had by specialization. So and a great example is in the medical field. Specialists, rightfully earn like huge wage premiums from a product of lots of education and experience requirements, highly specialized skill sets that are like really critical to society. To use a different example, though, the issue with specialization, though, then becomes about the transferability of using those skills across disciplines. And when you have a crisis like we saw in COVID-19, it's that transferability that really gets shown. And so to use another example of pilots, for instance, in the aviation industry, pilots particularly are highly, highly specialized, skilled individuals. All the analysis I do, though, is looks at when I look at pilots, there aren't a huge amount of transferable skill sets that can be readily applied in the market. This isn't to say they're incredibly educated and skilled individuals, but it's very difficult when you have a crisis that lands an entire industry. They can't move on. How do you move them between jobs? And which is why we saw Woolworths all of a sudden they open up and say, look, we have a huge amount of labour demand. Can you come stock shelves? But that to me sounds like a pretty ordinary transition. It's sort of systematic downskilling. So to get back to that kind of like meta question, the way that I kind of think about it in an ideal scenario, because I get asked this question quite a bit about, what are the skills of the future? What should I tell my kids? And it's like it's an impossible question to answer because you don't know the child and everything. But the kind of general answer that I give is you want to have a degree of specialization, and you want to dig in and kind of realize those benefits. At the same time, you want to have a foundation of generalist skill sets that allow you to be able to readily transition across. And the best example I can think of is the engineering occupational class. You see engineers, the mobility of engineers to high quality, high paying jobs occurs so readily. It's not uncommon for an individual to be trained as an engineer, finish university, perhaps go into industry for a period of time in the engineering industry, and then go to finance, or they go into biochemical engineering, or whatever it is. It's almost like they have this foundation of highly valuable generalist skill sets, and then they're able then to specialize as they please and sort of realize opportunities.
And you've picked on two topics there. One is that generalizable skills, and maybe just it's engineering, if you look at it as a basic set of skills around design thinking and the ability to look at something rather than actually just the engineering itself, and then being able to specialize through it. And in healthcare, we've been fortunate in Australia not to have such an adverse impact from COVID-19, but there are other health systems out there where a lot of these specialists have had to go back into the generalist skills and work in the ERs and not work in the operating rooms anymore because they're not operating anymore. But then again, healthcare is a sort of a biased example because there's always going to be work for them. It's not an industry which I hope will just shut down all of a sudden because we are always going to need them. But yeah, the example of aeronautics is quite a challenging option. So did you solve that problem? Were you able to sort out where these people's special skills could be used better, or is there something you're still working on?
Well, it's highly contextual to individuals. So, when I was looking at pilots, the thing that really came out was skill sets in sort of heavy machinery, which obviously makes sense, and so transfers reasonably well to things like mining, manufacturing, some agricultural jobs. You then get into another issue though around like the stickiness of labour markets, and what I mean by that is like individuals are very reluctant to move, especially in Australia where sort of geographic mobility is a lot lower than compared to something like the US or even the UK, Europe especially, and that's problematic. Another, even when there is a crisis, so a sort of more localized crisis. A good example was in around 2017 when the Holden plant got closed down. There was about 1,000 workers let go, made redundant. Those individuals in Northern Adelaide, almost none of them moved. And it's not like the Elizabeth area has a booming industry. When Holden closed down, it in many respects ripped the guts out of the community there. Individuals predominantly stayed. And what we saw was, instead of kind of this process of reskilling and upskilling, it was a systematic downskill. So most people found jobs, around 3/4 found jobs, but they were all worse quality jobs. They were all casual, part-time. That's the bit that kind of really scares me into the future of how do we do these transitions well to ensure that individuals receive good quality jobs, and if they're forced to transition, we're able to do this efficiently, quickly, and get them back into good gainful employment.
Because what you highlight there is, not just the fact that maybe there are multiple factors rather than just the quality of work they do, and also the way we train people, so that it's not just that, you finish uni, you get a degree and that's it, and you get a job. Is there something we work around there where we actually inculcate this thinking where there is no finite endpoint to learning? And the other part is around how do we look at people and environments together rather than just saying, well, let's pluck him out from one place and just put him somewhere else. I don't know, how do you see that happening into the future around skills provision, and especially as a challenge for Australian labour market around the world, regional, rural settings, and healthcare as a significant issue around provision of labour in our rural regional settings? Do you see that changing, how that could play out?
This is a major issue for Australia, specifically just the geographic scale and just how remote communities are. I used to work up in the Tiwi Islands, just north of Darwin, in a remote Indigenous community there. And I remember how difficult it was just to service the clinic and even the school, to be honest. So provisioning skilled staff for essential services is a really critical thing, really critical and difficult thing for Australia to figure out. But even to kind of come back from even those extreme remote cases, I still think it's quite difficult in even big rural settings. Places it can be challenging in even places like the Riverina in New South Wales. So your question on like,
how do you see that? I mean, firstly especially around the interface of AI and technology getting implemented, where whilst there's this big challenge, there's also the opportunity. And we have seen one of the biggest challenges we do find is the expectations of the community, where face-to-face is still preferable, and we still working in that space where, yes, we moved on to virtual in a lot of spaces, but we are still struggling to find a medium where we go redefining what can work in what space. And also in the end, we are defined by what the community expects out of an industry. So you have to fit the model to what the community or the customer wants, I guess. And I don't know if you've seen any, and especially since we are talking about health and the workforces, any other potential examples you see how things are changing in the future in that space around how the workforce is, or is there any generalist workforces out there? I know during the COVID-19 pandemic, we did find a lot of work for, again, like you highlighted, the airline industry people in our back-end operations. Whilst Woolworth took a lot, New South Wales Health did contribute. We required those specific skills, especially around contact tracing, because the call center staff, the flight attendant staff, who have that specific skills of being able to connect with people so rapidly and quickly and just move on and do those interviews. So we found great skills where we could transfer those skills. And I don't know how much exposure you had to the healthcare industry, but having those generic workforces move across was always a challenge. But I think things in crisis times are great. But how do you see this? How do you see that impacting the education sector, for that matter? And are you seeing those changes that you talk about? So our future workforce, is that transferable, or do you see that still as a challenge?
So just to clarify the question, like, is it how is this specific crisis impacting the education sector? Yeah. I mean, so it's turned the university sector upside down for sure. So all of a sudden, the universities who get a huge amount of their revenue from international students has just dried up kind of overnight. And that's been very difficult for them. And we've seen this very deliberate move by universities to move towards short courses, what they call micro-credentialing. Can we identify the specific skills that you need, do it over a concentrated 6-week block, potentially online, as opposed to, investing in a 2-year course where, there's a whole bunch of mandatory stuff that you have to do. Most of that you probably don't need, or it's decided by someone else. So I can see that there's this gradual arc towards personalization, and there's every reason to believe that that's going to continue. Universities, companies, and governments are investing a lot, including the company I work at, on how do you identify skill gaps? How do you do that sort of skill matching? So you as an individual have developed and have acquired a whole host of skills. How can I best represent you by your skills? And then understand your desire to move forward or to move on to another job, and really pinpoint which specific skills you need to acquire. Yeah. And then on top of that, like, which of those skills can you likely learn on the job through experience, or which skills do you actually need formal education in order to develop those skills and help you transition to that job? So that's really what I see happening here. COVID has just been an accelerant to all of this. And just so many other things.
That is, and it's interesting you say that, because a few of the other speakers have highlighted the same, is that maybe the system of enrolling people for 2-3 years of courses to lead them to a specialized path may not be what everyone needs. And maybe that micro-credential path you're talking about is really, it's more personalized, because even I've done that. You pick, here's a bit of things I don't understand about. Let me go out and just do a course or a certificate in finance, because as a doctor I never get exposed to that. I'm just going to turn the conversation a bit towards one of the other roles you're currently doing, which is around the use of AI. And I've heard about how these AI tools can link back to what you were talking before about picking what is that gap in the performance or the armory of a person you have. Are you seeing examples where companies are proactively using those tools to aid HR or education for their own workforce? And if not, do you see that happening into the future? And also, how do you see that impacting the labor markets, at least in Australia or overseas?
Yeah, so it's happening a lot, and it's a real boom time in terms of the kind of like almost skills market. It's almost, there are so many players now that it's big enough to almost call it a market, where companies like the company that I'm at Faethm, we're trying to represent individuals by their underlying skills, and we're trying to take a sort of real-time heartbeat of labour markets based on granular skill demands. So if you were to think about a job, or a job we can call which is like a standardized occupation, we can go down and start to define it into more granular levels. So we can go, okay, part of your job, you have many tasks and tasks are things that you do day to day to complete your labor requirements for your job. But within those tasks as well are skills that enable you to do the things that are required by your job. Previously, jobs were sort of represented as these buckets of things. Okay, we have an occupation, and that's it. We can tell you how many people are there, how much they get paid, etc. But it's an aggregated level. As data has gotten better and methods have gotten better, we've been able to go down to the atomic level, and that being sort of skills. And there are other dimensions as well which are really important. Another area that I work on is like personality profiles, and sort of identifying personality types for particular occupations as being descriptive. It's not prescriptive or anything, but there are many dimensions of an individual in their job and what makes them able or not able to do that job. And then if we can best represent that, you're able to identify pathways and make predictions.
Wow, the process of HR and interviewing in the future is going to be very different. I'm guessing rather than a cooked up pre-questionnaire of 10 questions, you could probably I can see that it'd be a very targeted questionnaire around certain things that your AI tool is saying, there's not enough information in that sphere. Let's interview this bit.
And that's already happening now. Like that's, especially the big firms, like that's occurring right now. Especially you hand in your resume, it will be processed, it will extract all the skills, your education, and it will build a sort of automated profile of yourself. I see that because this raises a whole heap of ethical questions and questions of bias, and it then gets into like I think we're headed towards a path of regulating a lot of these, and a lot of it is probably called for, but. Because like when you look at labour markets, and Australia's not immune to this, there are sort of systemic biases within labour markets, gender biases, racial biases. When you train machine learning systems to make predictions on the future, you learn from the past. So you take as good a representation as you can from historic data to make predictions however many time steps into the future. But if that data set is biased, your predictions will ultimately be biased. And that's something that's kind of front of mind for us constantly when we're building these systems. Because we're in the business of of helping people to make transitions for gainful employment, for high quality employment. Certainly don't want to pigeonhole anyone.
Yeah, it almost means, and happens in healthcare too, as in if you have a minority group that behaves differently and you use the wrong statistical methods, you might find that the algorithms we're using to detect certain conditions may be biased towards only picking, or the sensitivities or performance would be different in different cohorts based on what cohorts you built the algorithm on. Yeah, I totally agree. And it's a challenging time. And how do you regulate it and make sure that it happens in a just manner is going to be a great time for you here to be working in. So do you find those discussions happening now? And is there the right engagement in place with people like you to be able to provide that feedback?
Well, I mean, like at Faethm, we take it very seriously. Like this is constantly front of mind because people make consequential decisions on the recommendations that you put forward. More broadly, I think it's starting to happen, and there's some really great research that's happening. Like the AI Now Institute, they focus a lot on this sort of work. So it's like a really growing space. I suspect that there will be regulation that comes on board for a lot of even HR analytics work over the next few years. But it's very clear. Like one example that just came to mind quite from just some recent analysis that I did. I was looking at like personality profiles of occupations and trying to make predictions and see how well they perform. And so, you can represent tech occupations quite well, for instance, and they've got quite a uniform set of personality profiles. And so the predictions become high quality. And so you have low error rates. But the problem with that is like, okay, so that to me says, okay, either there's two kind of like potential answers, or there's multiple, but like two main ones stuck out. So one is like, okay, maybe that's just the personality profile of that occupation. It just has a clearly defined thing. People converge to that.
Yeah. No, and it's an interesting, not only interesting, it's a challenging topic because I'm just trying to translate that of what it means in healthcare. So if I were to say, design algorithms saying, who is a better doctor? And if you use the wrong factors, which talk about, things, the data we already collect in our systems, and that would be around how many patients a person sees or what outcomes the patients have. But is that really what we want our doctors to do for the future? Because then you would end up with a workforce which is highly, I don't know what the word for that is, similar to each other. And you're looking at, because we know that as we move from output to outcomes, and when you start collecting what our patients want from us, it changes the dynamic totally. So what factor gets what weighting, and how do you select those groups? And then knowing that the future might be so different that the current doctor you employ may not be the one which you need in 2 weeks' time. Because if you want someone to be doing those cognitive roles, more of those hand-holding roles, are we going to look for a more diverse workforce so it's almost challenging each other, isn't it? It's saying you're creating a workforce which looks highly alike, but then you also want them to be very transferable, so it just becomes a challenge for the future. And and then the other, and I also see an opportunity there though, and are you seeing it as well, is where when you've split out these professions into such small tasks based, and looking at every profession down to that granular level of what they do, how they do it, what's required in those skills. Because we did that during COVID. We did a risk calculator for COVID exposure based on your occupation. Because just looking at, and I think in the US they do it a lot. I think it's OLS, labor's group there, which spells out every profession, what the tasks are involved, and you could actually almost calculate what the risk of their infection was based on what the type of activities they were doing. We knew that economists were the least impacted because they most of the time were working from home, and dental assistants were the worst impacted because they are, based on the exposures they have. So you could use that. But do you see this also as an opportunity of picking out where the next product, AI or ML or robotic products could be put into based on those repetitive tasks?
Oh, okay. Yeah. So I mean, in general, AI is sort of excels at things that humans do quite poorly. So those kind of like repetitive, routine tasks. And then, but is kind of does a terrible job at things that other things that humans do quite well. Those kind of like non-routine, socio-cognitive tasks. So much of the caring community, caring industry, for instance, in my opinion, I just can't see that going away. It's not to say that the tasks within those healthcare jobs won't change. They will. They'll evolve with new technologies as they come on. But that sort of person-to-person contact, there is a lot of movement around, like, how do you integrate robotics into healthcare to sort of automate some of those tasks. But there is this sort of intangible caring element that humans provide, which is just so essential to healthcare. And I haven't seen anything compelling that suggests that that's going to go away at all.
It will change the way we work, but potentially not change the care we provide, or improve the care we provide by augmenting it rather than replacing us. Yeah, that's true. How you've been able to atomize the skill sets and the tasks in a person's occupation. And this has traditionally been a barrier to recruitment in healthcare industry, where the bar is quite high because there's so much certification and accreditation to occur before you can enter the workforce. Do you see that changing, especially since once we realize that there are certain amounts of pieces of work which we could potentially peel out and have a more generalist workforce in there, but then that again becomes a challenge because then you're over specializing the actual healthcare workforce there. Have you seen something of that happen, or do you see that happening in any other industries with corollaries?
Yeah, I mean the barriers into healthcare are very high, just from a regulatory perspective and credential perspective, even above the amount of education and experience and skills that need to be developed just to get in that. I personally don't see that changing. I see perhaps there are some, perhaps it starts to borrow from different industries, get some generalist skill sets. So, maybe it starts to pull more from occupations like data scientists and data engineers to make productive use of the mountains of data that it sits on, such as electronic medical records. I could certainly see that happening. And whenever the other interesting thing I've looked at, though, is I've looked at AI adoption from the perspective of like the skills required within industries previously. And consistently, healthcare was among the lowest. And it's not to say, so healthcare sort of is constantly taking new medical technology. So it's not saying overall it's not technology adoption, but it was specifically for AI related skills as a representation of the skills required to use technologies. and healthcare was just consistently the lowest of the 19 major industries in Australia, which is an interesting thing. I think so. I don't, to be honest, I don't see healthcare like. I think that those regulatory barriers with healthcare are very real, and that's something that is both necessary and also potentially impeding future progress.
Yeah. No, and totally agree with you, because I think on one hand, you could have a pro-team being accelerator getting the latest oncology treatment, and you could have a nurse standing next to it writing down the notes, and that's and then we could still have someone was just saying that one of our other speakers highlighted how someone was still drawing circles on a scan to decide what the radiation dose would be, but those were the tasks that they were able to get AI to replace, and then the radiologist was doing much more specialized skills like the human skills you're talking about. And I wonder what those challenges and barriers are, but that would be another topic of discussion another day. You did highlight there though about the EMR, anything and the data that sits under those systems. Any insights or any work you've done in that space, and or any thoughts around how that could be harnessed into the future?
Yeah, I've had just some minimal experience in the healthcare sector, working specifically in child health, and it is astonishing the amount of data like sitting underneath hospitals and healthcare providers that just sits latent, and the ability. As someone that, as a trained data scientist, I sort of looked at this and thought, oh my goodness, like what an immense opportunity. This isn't just like, and I'm not saying that it's like perfectly collected data. There are a lot of major issues, and there's a huge amount of privacy issues around making inferences as well on individuals. All of that aside, that to me is like, from an outsider looking into the industry, that to me is just one of the biggest opportunities.
Yeah, no, I agree, and I think that's what goes back to the point we were talking about. As data becomes more and more available and accessible, and maybe it is about creating those safe and secure access points, and maybe getting that. How do we get that done in a safe manner so we can get the highest value of that data that is recorded in our EMRs? And as you highlighted around those, the triangle of the environment, and the person and where they're going to be working around. It's the same in healthcare as well. Is that health outcomes are, whilst we always focus on the things that the patient does, we also, the data which sits on and that's just one portion of the data, but also has an impact on the provider, what the provider is bringing in, like things like you looking at, what are their skill sets? Maybe the future is about matching those two and saying, we know that this is what the patient needs, and this is potentially the best provider for this patient. And then where is the best environment, and what are the best environments to provide that in care in, and bringing those data sets in together in a safe and secure manner could be a great thing for the future. But surely there are a lot of challenges along the way. Look, it does you've really brought in some great points around those workforce and how the future of workforce needs to be more agile and more transferable, and how we are going to be recruiting the workers of the future. Do you see the millennials or whoever the next generation is getting prepared that way? And or as you say that the not just health industry, all the industries are micro-credentialing, and the way people are changing around. Do you see the next generation almost prepare itself for this, or is it a work in progress?
I think that the kind of next generation, like kind of the generation kind of graduating university now, or young professionals. Like these are people that have been shaped by two crises now. So, and myself included. So, graduated undergraduate kind of just after, within that height of the financial crisis, graduated PhD during COVID.
Yeah.
And, a whole bunch of friends very similar in very similar situations. And I think that shapes a generation. I really do. And how that relates to skills is that it's sort of acutely aware that the world can be turned upside down in an instant. And you have to have a strong foundation to be able to deal with such immense changes. And you have to be prepared to change really quickly, change your career. I think that is more than ever front of mind for this kind of next generation coming through. And more than that, they're sort of demanding it of education institutions. Universities have been quite slow to get to the game. COVID has been the accelerant here. They were sort of playing on the edges with this before, and now they've been forced to do it. But individuals, I believe, like have wanted this for quite a long time. So I'm optimistic. Perhaps I'm biased because I'm sort of insisting this.
Yeah.
This generation. I'm not saying it's sort of perfect generation. There are a whole bunch of issues, but
I totally agree. And maybe the future is where you do have a base set of skills, and instead the level of specialization is an ongoing journey of micro-credentialing rather than this 6-year program on top of, which sorts to bias out, create a lot of gender and economic and racial plus, socioeconomic biases, because only a certain few can afford to go that far into that specialization cycle. We see that impacting our health workforce acutely as well. So, especially I feel that this whole post-graduation specialization kind of view means that a lot of our doctors aren't coming out into that at that pointy end by the time in the early or mid 40s. And that means that puts it as a significant disadvantage for our female colleagues to be able to plan their social and family life around it. So like you highlighted, COVID-19 has been a great accelerant in that space. And I think hopefully the organizations will move in that space. So it starts to, your learning journey doesn't begin and stop at university checkpoints, but it's an ongoing journey across your lifetime.
It's been the optimistic side of this as well is that it's never been easier and it's never been a better time to be able to pick up new skills and from world-class educators. And that's really true. So if you wanted to become a data scientist or a data analyst, like you really don't need to go to university anymore, assuming you have the motivation to do it. And that motivation piece is a big bit, and it's why a lot of people decide to go down that formal route, and that's totally valid. But the amount of content available online is just immense. There are other occupations, such as in healthcare, where there are those regulatory hurdles that you need to satisfy, and that that's there for a reason. But there are a whole host of other occupations and industries where it's not such a big deal. I know, like Google, for instance, they eliminated their need for university credentials anymore. So people are potentially just getting hired on the quality of their code rather than where they went to school, in theory.
Oh, well, looks like it's going to be a multicolor and a really great time to be into the future. And thank you so much, Nik, and be great to keep in touch.
Awesome.
Speak to you soon.
All right, see you later. Bye.
So that's all we have time for this episode. Thanks for joining me on the show. If you enjoyed the podcast, make sure to like, share, and subscribe on whatever platform you are on right now.